We are live. We are live. I'm Dr. Frita, and welcome to Dr. Frita Live, where we talk about the latest trending medical headlines and celebrity health news. Boy, do we have an evidence-based medical show for you today. We're going to start off talking about Perez Hilton. Do you remember him? Celebrity blogger from back in the day. Well, he is sharing that he almost passed away from sepsis. Yes, he had a 21-day hospital stay, start off with the flu, ended up with an ulcer, and then in just full-blown sepsis. And so we're going to talk about some of the different infections and things that can lead to sepsis and how to recognize sepsis and even septic shock in yourself. And then we'll talk about tummy tucks. That sounds pretty benign, right? Tummy tucks, abdominoplasty. Well, a TikTok mom actually passed away after having a tummy tuck. And she's the mother of 3, and she was very open sharing her journey on social media. And so we'll talk about tummy tucks and other cosmetic procedures and what to do as far as your due diligence when it comes to choosing your surgeon. And very importantly, we need to understand that regardless of the cosmetic procedure, there are risks, but I'll help you to really kind of figure out the risks versus benefits and kind of what to do to protect yourself. I'm really sorry about that, Mom. Then we'll get into my favorite game. Y'all know my favorite game, myth versus fact. We are coming to the end of Kidney Disease Awareness Month right here in March. And so we're going to end it with a bang in my favorite game, myth versus fact. Kidney pain versus just run-of-the-mill back pain. How do you know the difference? Is it life-threatening, or is it like letting you know that your kidneys might be on the end? We're going to do some myth versus fact statements to help you differentiate when you just have run-of-the-mill back pain like musculoskeletal versus are your kidneys failing. Oh, I'll let you know. And you know I'm a board-certified kidney doctor. Buenos dias. All right. And then I'll give you your second dose of the medical headlines where I give you a spin you simply can't get anywhere else. And we're going to talk about Cardi B. Everybody's talking about Cardi B and her concert. But guess what? She has teamed up with a certain drink, and it has the sweetener stevia, okay, a 0-calorie sweetener. But here's what I want to know. Is drinking diet sodas better than drinking sugary sodas? Or are there some risks and benefits to both? Okay, can they cause cancer? Can they cause you to have an increase in sugar? And is her choice of a drink with stevia one of the better sweeteners? Oh, I'll let you know. I know you're itching to know. I'll let you know. And then we will talk about the allergy season. Yes, because it's here. It came early. Why does it feel like pollen is more intense on cars already? Because it is. Why does it seem like allergy season came early? Because it did. So I'll let you know why allergy season is here. And more importantly, I'll give you some very important tips on how to reduce all of your itchy eyes, red eyes, running nose. We'll talk about it. And of course, we are live. And so you can ask me questions. I'm going to ask you questions too. You know how it goes here. And guess what? Even after the live, for my chief med heads, you know, members only, we're going to have a live Q&A. Okay, so let's go ahead and let's get started. Welcome to Medical Monday. I'm Dr. Frita. Let's get this thing going. Hey, we are live. I'm Dr. Frita. Welcome to Dr. Frita Live. We're about to talk about the latest trending medical headlines and celebrity health news. I'm not talking about it by myself. I'd like to welcome my office manager and co-host, Mr. Shador, to the stage. Come on, Miss Shador. How you doing?
Hey, Dr. Frita. Good. How are you doing today?
Good. How was the weekend? Did we get any T-ball in? Did the little one play any T-ball?
Yes, open season started Saturday.
How did that go, Shador?
It went well. Better than last season, but it went well. It's one little boy on the team. He's a professional. He's professional already in his mind.
Oh my gosh, professional 4-year-olds. What are we going to do? But that's good. But he's having fun though.
He is, absolutely.
Look, and what about his little cousin?
Oh, she's enjoying it today. She was eating her breakfast in the dugout before the game started. She had to get her protein in.
You better get your nutrition in, 4-year-olds. Okay, I love it. Yeah, we had some sports this weekend. Of course, first we laid to rest my Uncle Ozell, my mom's oldest brother. He was 85 years old, the oldest of 16 siblings, the oldest of 16 siblings. And, and he was also my first babysitter. A lot of love for Uncle Ozell because even though he was just a child, he actually, did a lot of work. He pumped wood. He was working like a grown man as a child, didn't even get to completely, finish his education. But because of his sacrifices, my mother, her siblings, they were able to thrive, to go to college, to do all of the things because of their oldest brother, Uncle Ozell, the oldest of 16. So went and celebrated his homegoing this weekend. And then came back just in time for some basketball. The twins, my ninth grade twins had a real good basketball season. So it was a weekend of up and down emotions. Very happy to be here today, to have this Dr. Frita Live. We're hopefully we can give some good education so that we can live our healthiest, happiest lives, long lives, good quality lives. Shador, who was the first person in the chat?
First in the chat today, Miss Aileen.
Hi, Miss Aileen. How you doing over there? All right, get ready because in the myth versus fact segment, I got questions for you, Miss Aileen. Let me see what you know. Let me see what you know.
And shout out to our members checking in. We have Miss Dietrich.
Hey, Miss Dietrich. Thank you for being a member.
Absolutely. Hey, Miss Rosalind.
Miss Rosalind, tried and true. Thank you.
Miss Deidre is here.
Hello. Thank you.
Miss Andrea.
Day one. Hello. Thank you for being a member.
And Peace Oasis is here as well.
Peace Oasis. Listen, for all of my members. I just posted something this morning for my resident members and my chief medhead members. And then I'll be posting something else this afternoon, one of my healthy habit quick tips. I'll be posting that for you this afternoon for all of my members. And then, of course, if you're a chief resident member, we have our monthly live Q&A today. During that time, I don't do all the talking. You get to do the talking. You come and you ask me questions. If you're not a member and if you're not a chief resident member, it's not too late to join. We have a link in the description. And then, of course, always in my one-stop shop, drfrita.com. You can always join that way. And, with that, there really are great benefits to the membership, especially at that level, because for those of you who are new to us, I am Dr. Frita. I'm an MD, I'm a medical doctor, and I have been quadruple board certified. I'm a board certified kidney and high blood pressure doctor. I am board certified in internal medicine. I am board certified in obesity medicine. And after I completed my dual med-peds residency at Georgetown University Hospital School of Medicine, I also earned my board certification in pediatrics. And so I love to learn. And very importantly, no exaggeration, I literally read medical journals every single day. And so I stay up with medical knowledge, and I love to share the medical knowledge. And that's where you come in. When you are a member, that's when you get the ultimate access to all of the medical information that I love to just share. I do. I love it. And so members of all levels, I got videos for you. I got quick tips. And then, of course, the higher the level, the more access you have to really having just less of you there and more of me. And you can ask me questions about, what's going on with your other doctor's visits. If you want a second opinion, if you want to just ask about loved ones, if you're curious about things, then you can do that in our live Q&A, which we will have today. It's not too late to join immediately following the live. So yeah, please go ahead and give us a join. And thank you to everyone who supports us here on the Dr. Frita YouTube channel, because we are up to over 976,000 subscribers. We're inching there. We're getting there to 1 million, but I appreciate you all. So please go ahead and give us a like if you have not done so already. That really helps the algorithm. And let's jump into this topic, shall we? Let's open up talking about Perez Hilton. Okay. Perez Hilton, a celebrity blogger. He's been tried and true around for quite a while. He's 48 years old now, I believe. And he shared that he became ill. He had the flu, influenza. And y'all know this season, the super flu, it has been just a mess. We've had really difficult numbers, and we've had some people who have passed away. In fact, just a couple of days ago, we had our first teen pediatric death of the season from the flu. At any rate, the flu's been very serious. So he had that, was taking medication for it. And he shared that he had some other complications, an ulcer, and then ultimately he had sepsis. So let's go ahead and let's play this clip, and then we'll talk about sepsis, kind of ways to recognize it and ways to prevent it.
My stupidity landed me in the hospital for 21 days.
Perez Hilton is getting candid about a scary situation. In a video message to his fans, the blogger details how he ended up in the hospital for 3 weeks, a period which he documented on social media and is hoping followers will learn from his mistake. Perez shares in a March 23rd Instagram video.
My stupidity landed me in the hospital for 21 days. And this is the most important video that I've ever shared.
The 48-year-old, whose real name is Mario Armando Lavandera Jr., said that he'd had the flu for about a week and began taking medication to get better.
I didn't take any of my medication with food. I never have.
Unfortunately, the medications were extremely hard on his stomach and intestines. After a week of taking them on an empty stomach, he developed an ulcer, a perforation, and sepsis.
Okay. So I'm happy that he's doing better. I'm also happy that he's sharing. I do take exception to one thing. He said that he ended up in the hospital for being stupid. No. The thing about it, it doesn't matter how smart you are, how many brains you have, how much emotional intelligence. If you don't know, you don't know. Okay. It's not necessarily common knowledge that you have to take medications with food. You don't have to take all medications with food, you know? And then if he was taking medications because he had the flu, well, already he doesn't feel like it, right? Already he might not have had an appetite, might not have been that thirsty. And so he definitely is not stupid. And I really appreciate him because I think he's very smart to share to help other people from going through the same thing. So we're going to talk about it. But here's what I want from you, MedHeads. I want you to answer this question and put one of those little green virus germ emojis, okay? Like I think you type in germ, the emoji will pop up. One of those little green germy emojis. Y'all know I love my emojis. And I want you to answer this question. Which symptoms do you think that people tend to dismiss most often? Fever, stomach pain, nausea? What do you think? Which symptoms do people tend to dismiss most often? And you can choose whatever symptom that people know they know they have it, they're feeling it, but they're like, I'm not calling the doctor, and I don't want to go in. Okay, put that in the chat under your little green emoji, and then let's talk about Perez Hilton. So the flu, we already mentioned that, the super flu was really bad this year. And it is recommended by the CDC that starting at the age of 6 months that people are vaccinated with the flu vaccine. Is the flu vaccine perfect? Absolutely not. But even if you get the flu vaccine and still end up getting the flu, then it does help to decrease the intensity of the symptoms. It helps to decrease your risk of being hospitalized. And quite frankly, getting that vaccine helps to decrease your risk of passing away from the flu, even if you get the flu. Okay. Full disclosure, I get the flu vaccine every year. Of course, it's required for the hospital I work in. You either get the flu vaccine or you have to wear a mask all flu season. And quite honestly, flu season goes from October all the way till May. Oh, anyway, so he had the flu. And so he's reported that in taking the medication with no food in his stomach, it sounds like eroded his stomach and developed an ulcer. And we know that an ulcer is an erosion of the mucosal lining of your stomach. If you have a stomach ulcer, and if that erosion gets deeper and deeper, then of course you can have a really thin wall of the stomach, and then you can actually get a hole in the stomach or perforate. And that's what happened to him. He had a perforation. Well, if you have a perforation, then what that means is then all of the stomach contents, the acid, the food, and if that perforation had even connection with the intestines, then even some bowel contents, some intestinal contents can go into the rest of your body. And what happens then? Well, of course, what's your gut filled with? Well, it's filled with bacteria, right? Like E. coli, Klebsiella. It's normal to have bacteria in the gut, in the feces. If that gets into your system, then you will have an infection, right? An overwhelming bacterial infection or bacteremia. Well, as that continues to progress, then you can develop sepsis. And here's what sepsis is. Sepsis is your body's incorrect reaction, okay? It's an incorrect immune reaction that occurs after an infection, and it causes your immune system to then attack other organs, either healthy organs. Then it can lead to kidney failure, respiratory failure, liver failure, circulatory failure, meaning you no longer are able to maintain a proper blood pressure, and you can have very low blood pressure or hypotension. And so the sepsis can go into septic shock. Okay. You get multi-organ failure, septic shock, and quite frankly, it's extremely life-threatening. And what he describes in his 21-day hospital stay, that's what he developed. Okay. And so the take home for this is pay attention to your body. Don't ignore symptoms. And we're about to see what the med heads have to say about symptoms that people very commonly ignore. And so we'll talk about which symptoms not to ignore so that you can prevent sepsis in yourself. And it can be from bacterial infections, viral infections, fungal infections, you name it. All right. Which med heads participated?
All right, several, Dr. Frita. Peace Oasis, getting a tongue tied every time. Fever and nausea.
Fever and nausea. That's true. Because when you think about it, Peace Oasis, you can get fever and nausea from just a common cold, right? Or you can get fever and nausea if you have a little bit of food poisoning, like a gastroenteritis, and you might like say, oh, I'm just going to wait it out. You can get fever and nausea if you have the flu, and maybe it's just a mild flu. And so a lot of people ignore that. But the key is that if you're getting a fever, that's a very high fever, especially if it's over 103 degrees Fahrenheit. If you have nausea to the point where you're actually unable to eat, unable to keep down fluids, and you can become dehydrated, that's when it's time to contact your doctor. And certainly if this goes on for more than 48 hours, forget it, go into the doctor, because then that can lead to dehydration, kidney failure, and even not being alive. So yeah, so those are two symptoms that people often ignore.
All right, Charlene.
Hi, Miss Charlene.
She says stuffiness.
Stuffiness. A lot of people ignore stuffiness. In a lot of ways, you might be able to ignore stuffiness if it's just congestion. Okay, if it's congestion, but you're still able to breathe well, you're not breathing quickly, you're not getting blue lips, you're not getting blue fingers. But when the congestion becomes a problem is when it spreads from being just congestion, like, a little bit of a stuffy nose, to actually having respiratory distress, where you're pulling and you can almost see the muscles pulling in your neck using your accessory muscles, or if your stomach is going in and out where you can see the ribs, especially in children, if you are not able to complete a full sentence without taking a breath. Okay. When that congestion transitions to shortness of breath, that's when it's time to not ignore that symptom. But there are other things you can do for congestion, especially if it's related to allergies. And we're going to get into that today.
All right. Remember, Andrea says stomach pain.
Stomach pain. And let me tell you something, Andrea, that's a big one. And so like in his case, he had the stomach pain, and I'm sure there was probably quite a bit of a hint before it actually perforated, for the ulcer perforated, right? But we think about stomach pain, maybe I ate something wrong, or maybe I'm just nauseated because I have the flu. We come up with so many excuses. But if you're having stomach pain to the point where it is severe, where it's having you pretty much doubled over and you can't get to a place, any kind of a point of being comfortable, if the stomach pain is causing you not to be able to get your nutrition, okay, not holding in your nutrition, and certainly if you have the stomach pain in conjunction with any type of vomiting up of blood or having blood pass through the stools, okay? And here's the other thing about stomach pain. It's not just necessarily infection related or even sepsis related. Stomach pain can be an atypical symptom of cardiac chest pain, right? Heart attacks can prevent as stomach pain in some cases. Now that's a big one that gets ignored, especially by women who often have atypical symptoms, and diabetics. So yeah, pay attention to that stomach pain and don't just sit up there and say, oh, it's okay. Because if it's going on for days, or if it's extreme, or if it's combined with other symptoms, then yeah, talk to your doctor.
Absolutely. And explosive 33 went the easy route. Is that all?
All of them. Look, you're about right, explosive 33. So the bottom line, when it comes to sepsis, these are the things that we talked about, some of them, but just kind of to sum it up a little bit. When it comes to sepsis, again, if you have a high fever that's persistent, if you're not able to keep down food, especially if you're not able to keep down fluids, that's a big thing. You can go without food for some days, but you can't go without having a proper amount of water. And you know your body. I know people say that all the time when they're not trying to listen to their doctors, but you know what's normal for you. You know what's normal at this point, probably from run-of-the-mill illnesses. If it's something that's just not meeting the norm, if it's extreme, or if you're unsure, call your doctor, because if they catch an infection early or catch sepsis early, it can prevent you from going into septic shock, and it can save your life. Okay. All right. Thank y'all for your participation. Please go ahead and give us a like, give us a subscribe as we keep on moving, don't stop. Oh, I'll tell you what, this next story does not make me happy at all, and it won't make you happy either. There is a mom who has been on social media. She's been a TikTok mom sharing her journey and she actually shared her journey of going to get a tummy tuck. Well, she's a mother of 3. She has a husband. She had the tummy tuck, and then she passed away soon after. Okay. And so we're going to talk about tummy tucks, abdominoplasty. Let's go ahead and play this clip, and I'll see you on the other side.
Questions are being raised after a Warren County mom died following a makeover performed in Cincinnati. Rachel Tussey of Franklin had plastic surgery that ended in tragedy. The mother of 3 and TikTok creator shared her life online under the username Midlife Unmuted. She posted about feeling both excited and nervous ahead of the surgery, asking followers for prayers. According to her family's attorney, Tussey suffered a catastrophic medical emergency after the procedure at the Journey Light Surgery Center in Evendale. Now, she experienced a lack of oxygen that caused severe brain damage. She was placed on a ventilator, and on March 5th, her husband made the decision to remove her from life support after doctors determined she had minimal brain activity. Now, Tussey died Tuesday, surrounded by her family. Her attorney says an investigation into the circumstances surrounding the surgery is now underway.
That's so sad. That's so sad. And yes, she was having a tummy tuck and she was having a cosmetic procedure. I will say that in many cases, the tummy tucks or abdominoplasty can be functional surgeries as well. If someone, for example, has a diastasis, or if they have, like, especially after they've had a baby, or if they've had a lot of weight or fat in their stomach, sometimes you can have a separation of your abdominal muscles, the rectus abdominis, and then your intestines are essentially kind of exposed, and you're not able to bend and move, and you have low core strength. My point is, not all tummy tucks are strictly cosmetic, but even if they are, you have the right to want to feel good about yourself, to have your surgery, to have your body the way it used to be, to feel happy. That is your right. And this is certainly not a bashing of cosmetic surgery. And it's certainly not a bashing of this mom, because quite frankly, her surgery was performed by a board certified plastic surgeon. It was performed by a board certified plastic surgeon. And so let me ask you this, and I want y'all to give me some wings in the chat. Give me some nice little angel wings and as an emoji, and answer this question. What do you think are some of the most important questions that one should ask before having a cosmetic procedure? What are some of the most important questions one should ask before having a cosmetic procedure? Okay. And you can go a little deeper with that if you like, and just kind of say some do's and don'ts, like what you shouldn't do before getting a cosmetic procedure. But going back to this young lady, this mom, again, she went to a board certified plastic surgeon. And so number one, I'll go ahead and give that answer. The first thing you should ask is, are you board certified? And look up their credentials. Okay. Look up their credentials, because a lot of people, they might be a board certified doctor, like a board certified internal medicine doctor like me, or they might be a board certified plastic surgeon, or they might be, a board certified, something else. I mean, they might be a board certified internal medicine doctor. They might be a board certified family medicine doctor, but you want to make sure your doctor is board certified in plastic surgery. To be very specific about that, because plastic surgeons are, of course, trained to give you like the best cosmetic results, but also these are medical doctors. They're trained in the likely risks and complications, and you are less likely to have a complication if you're going to a board certified plastic surgeon. Case in point, a lot of doctors, even non-board certified plastic surgeons, even non-doctors have the ability to do certain things like BBL, the Brazilian butt lifts. But if you're doing them at a large volume that's not actually recommended by the board of plastic surgery, like, some of these pop-up shops, discount BBLs that might cost $2,000, $3,000, they might be putting out 10 and 12 BBLs a day. But if you're going to a board certified plastic surgeon, then they're typically doing no more than 3 or maybe 4 a day. Okay. Taking that extra time, making sure they're not rushing, helping to decrease your risk. Okay. Just there's little things like that. It might not seem like a huge deal, but certain things, board certified plastic surgeons are going to be held to a certain standard. Okay. But in this case, and we'll talk about what you say about what are the best questions. Let me just tell you what an abdominoplasty is, or a tummy tuck. It occurs for the ladies or men who seek these tummy tucks, is when you have like loose skin, oftentimes after you've had your abdomen stretched, either from a baby, which is why they'll call them mommy makeovers, or just from a lot of weight. And you might lose the weight, you might get all the way down to your ideal weight, but you'll have excess skin, okay, or pannus, and just the skin that's really there, it's sagging, and so you're not going to get that little bikini stomach that you might want. So you get a mommy makeover, okay, that's fine. But so what they do is they'll make incisions somewhere between your navel and your pubic area, and you might have a mini tummy tuck or a mini abdominoplasty, or you might have one where the incision wraps all the way around to your back to where your love handles are, okay? And in extreme cases, say if you've had like a over 100-pound weight loss or 145-pound weight loss, they might even do a vertical, like an up and down scar, and the horizontal one, like a T, to really, tighten the skin, put the muscles and your abdominal muscles back together, remove excess skin, and give you a flatter, more cosmetically pleasing stomach. So that's what she had done. And again, she went to a board certified plastic surgeon, and according to statements from his team, everything went well in the procedure, and she went to heal at a surgery center. Okay. And so the surgery center has their own standards. And reportedly, according to her husband, I heard it's out of his mouth because he said it on the news, but out of his mouth, he said that she was given some pain medications and narcotics, and soon thereafter, she had what looked like respiratory distress. She lost oxygen, and then ultimately he made a decision on March 5th of this year, I believe, to pull the life support because it was found that she had very little brain activity, anoxic brain injury, it sounds like with low oxygen. So it happened while she was right there recovering, so very soon after the surgery. And so I'll keep you updated with the story. And again, it sounds like, at least in her choosing a board certified plastic surgeon, that she didn't do anything in particular that was wrong. She didn't go to some place where she didn't know. So then what can you do? What can you do? Well, y'all tell me, med heads, what do you think some important questions to ask before you have a cosmetic procedure?
Absolutely. So KK.
Hi, KK.
What are the possible complications?
Good. That's a very good question. Pretty simple and to the point, right? Because if you're dealing with abdominoplasty, tummy tucks in particular, some of the common complications might be, local infection, or maybe some fluid that collects under the stomach, seroma. You might get a hematoma, some blood collection at the site. It might even have to be surgically drained. And again, an infection, although they do, perform them under sterile conditions. So getting sepsis is not as likely, especially if you're going to a board certified surgeon. But then in about 4% of the cases of abdominoplasty, you can get more serious complications, such as DVTs, okay? The deep venous thrombi, where you have literally blood clots. And so that can be a complication, or you can get the infection or sepsis that I mentioned. That's more rare, but those are some very real possibilities. I don't know the specific complications for this young TikTok mom who passed, but yeah, what are the complications? Yeah. Oh, and then specifically for the BBLs, okay, that's the most dangerous cosmetic surgery, period. Even for board certified plastic surgeons, the most amount of fatalities happen with BBLs. And you can get DVTs, you can get infection. Definitely infection is a big one, especially with the surgery being so near the anus. Okay. Fecal contents can seep out. But also, if you're doing the surgery blindly, like just taking needles and putting the fat in the person's buttocks, if that fat goes into one of the large veins, then that fat can travel from that vein all the way up to the heart and to the lungs, causing a pulmonary embolus, a blood clot to the lung, and cause patients to pass away. And so that would be a complication that would be shared if you're going to a board certified plastic surgeon, because it could happen even with them, the board certified doc. Okay.
I remember Dietrich would ask, what are the risks?
Very good. Yeah. So I agree. So that's going to be the biggest thing. What are the risks? And then I would even take it a step further. What are the risks? What are the likelihood of the risks? And hello, you specific surgeon, how often have you had these risks? Okay. And I'll be looking at the doctor right in the eye, and getting an idea of body language and your comfort, with the doctor, and how honest they are with you, or if they get defensive. That's going to be important. Good.
All right, Miss Aileen.
I'm Aileen.
She would ask, how many years have you been performing this procedure?
Very good. Okay. You don't probably want to be the very first case, right? And so even if it's a board certified doctor and they're going to do your abdominoplasty, ask the question, because if for 10 years they've just been doing, I don't know, facelifts, breast surgery, I'm not really sure, but they're like, you know what? I really haven't done too many of these. then you might want to ask for someone else in the group or for a different group. But it's a perfectly fair question. How many of these have you performed? And that will give you an idea of the skill level and if they have had a likelihood of being able to avoid risks just through their experience. That's a good one. How many of these have you done? I was sure enough asked.
All right. With
I
that
hope
question,
everybody's taking notes. These are good questions.
with that one, TS would ask,
Hi, Tia. Welcome.
is the facility in the hospital or certified, or is the anesthesiologist familiar with the office or this procedure?
TS, you better come right to the front of the class. Because let me tell you something. For a lot of these surgeries, they're either same day surgeries where you go straight home, or they're in surgical centers that aren't actually at the hospital, right? And so they don't have a whole team. Like if you were to code or go into cardiac arrest, they don't have a team of physicians who are able to handle that at the top level if it's just a little quick same day surgery. So ask the question about the facility, ask the question about who all will be on staff, ask the question if something goes wrong, if I code, if my heart stops, is everyone here CPR certified? And even if they are, do you have the ability to intubate me here, put a breathing tube down my throat here? And if the answer is no, that might be fine if you're healthy. Because even with a tummy tuck, with a same day surgery procedure center, if you're considered to be a healthy person, then quite honestly, that's not a deal breaker. But if you're someone who knows that you're living with obesity, which many people who are seeking tummy tucks, many of them are living with obesity or have had complications associated like the diabetes, high blood pressure, high cholesterol. If you're a smoker, all of these things increase your risks for complications with cosmetic procedures like abdominoplasties. If you're of an older age, 55 is considered to be a high risk age when it comes to abdominoplasty. So if you're older than 55, you're considered to be of a high risk age. If you have these complications, I would ask the surgeon or make a request. Can you do my procedure in an actual hospital? So if something goes wrong and if I code, I can be taken straight to the ICU instead of you having to call 911, have an ambulance come where it might take 10 minutes. And in those 10 minutes, my brain cells might already die. Okay. My heart muscle might already die. So asking about that facility, TS, that's going to be top notch. Mm-hmm.
Yes. All right. 13, Joy.
Hi, Joy.
What should I expect after this procedure?
Okay, so like the healing process, that's very good. So find out, because if you get a BBL, for example, you're not going to be sitting down on hard chairs doing this. You're going to have to be on cushions or even sleeping off of your bottom. You need to ask, as far as the healing process, and ask them in their experience too, what their patients deal with. How much pain medicine am I going to need? Am I going to be able to walk? Am I going to, what can I expect after this procedure, including likely complications? That's a good question as well.
All right, then I'll end with G1. G1 says, what are the mortality rates? What are the pre and post procedures? Am I a good candidate with my current ailments? And what if I don't like the outcome?
All of it. You come onto the front of the class. Absolutely. So we talked about some of those risks. Ask your surgeon about the risk. Ask your surgeon if you're good. Because a lot of people, when they go, especially the cosmetic procedures, you just want them so badly. You just want to get them done. You want to get them done. You don't want anyone to tell you no. But again, if you have some of these risk factors, like living with obesity, being a smoker, being older than the age of 55. No, I'm not calling being older than 55 old at all, but it is just one of the statistically significant risks. Okay, and getting cosmetic surgery. Certainly if you have diabetes, if you have heart disease, then the answer is, from an honest doctor, is going to be, well, you are a high risk patient. Okay, they may still do the surgery as long as they explain the risks to you, but it's up to you to use your good common sense that the Lord and your mama helped to give you, and you make the decision. So yeah, those are all, that's gonna be good. You come on up.
All right, and then Peace Oasis had a question particularly about the young lady. Maybe you know, maybe you don't. Did she have any other medical issues that could have been a complicating factor from having anesthesia?
See, and that I don't know. And her lawyer, who made a statement, did not, surprise, did not state that she had any type of a complication. So I don't know if she was a smoker. I don't know if she had asthma. I don't know if she was living with obesity, at the time of the surgery. I don't know if she had high cholesterol. I don't know if she had abnormal heart rhythms. I don't know if she had coronary artery disease. All of those risks, I don't know. And that's going to be something if indeed this is if they have a lawyer, so very likely there's going to be some litigation. Those are the types of questions that they're going to ask, but I don't know at this point. Yeah.
And
I do know.
I'm sorry, Dr. Frita. What you
I
saying?
was saying I do know that she saw a board certified plastic surgeon, and so at least from that end, she did what she was supposed to do. But I don't know if he was at fault. You know, his team has made a statement that he was not. And then she went to the surgery center. I don't know if they were at fault. They say they were not. I don't know if they gave her the proper doses. I don't know if there was something that was missed, you know, or was this some type of a freak accident? Did she have an arrhythmia that could not have been predicted? Because with all surgeries, there are risks that we tell you about that can happen even if everything goes right, but it's still premature, and we'll find out as the investigation goes on.
Yeah, absolutely. Yeah. And then Beth shared a personal story. Beth said, I had elective facial surgery. Afterwards, a couple days later, I had severe back pains and severe pain in my right leg, numbness and toes. Been 8 months now, and I'm now scheduled for an epidural. And her surgeon was board certified for 10 years. And after surgery, looked worse than before the surgery.
Oh, no. I'm real sorry that happened to you. I'm very sorry that happened. And I'm wondering if it was, I guess it's hard to know, you know, what the cause was. You wouldn't think just standard facial surgery would be related, you know, for someone. I'm not just talking about you specifically now. I'm just kind of going to go travel down a rabbit hole of differential diagnoses. But, you know, getting leg pain, numbness, toes, you think, did something happen? Was there a blood clot, a deep venous thrombosis? Or was there some type of an arterial clot that, you know, got somehow dislodged and caused a numbness in the toes? Well, you know, did something happen in the back? You know, was an epidural given by an anesthesiologist for whatever reason, and did it affect the nerve some type of a way? You know, or was it simply a matter of being sedentary after surgery, as most of us are, and then you get a blood clot in the leg? I know I'm not saying that's what happened to you. I know you haven't shared your diagnosis. I'm not asking you to share your diagnosis. I'm just kind of going through a differential diagnosis. Either way, I really pray that you do well going forward, and I really am sorry that happened to you. Yeah. Okay. Dang, y'all participated quite a bit today. All right. So bottom line, in getting cosmetic surgery, weigh the pros and the cons. I hope y'all took notes from all the med heads on the right questions to ask, because y'all hit the nail on the head. All the right questions to ask, including, am I a good candidate for this surgery? I can't help but think about Kanye West's mother, who had surgery. I believe it was a breast augmentation, and then they got passing away reportedly from complications. And it was reported at the time that she had been told by another surgeon that she actually was not a good candidate for the surgery. It might have been from high blood pressure. I don't remember exactly. I believe it was high blood pressure. Don't hold me to that. But I do know that it was reported that she was told by another surgeon that she was not a good candidate, but she found a surgeon who did do the surgery for her, and she ended up having complications. So that's the other thing. Don't just go around searching for the person who's going to do a procedure. If someone tells you that you're not a good candidate and it's a reputable physician, don't push it. Don't hide information. You know, as long as it is elective in cosmetic, it's not worth your life. Okay, it's not. We don't want beauty to kill. Okay, so we got to make some wise choices. All right. So certainly praying for that lady, the young lady and her family. All right. Please give us a like. Please give us a thumbs up, and please make sure you share with us in your group text, share with us in your WhatsApp, your group me, on your family chat, on your family page, all the things. Email us, tell your mama, tell your daddy, tell everybody to come watch us. It helps the algorithm. We're giving you evidence-based medicine here, including kidney information. We know that March is Kidney Disease Awareness Month, and it's not over yet. It ain't over. The party ain't over. Okay, do y'all know what song is that? Y'all, whoever knows, you're going to age yourself if you know it just from that little thing. It ain't over. The party ain't over. What group sang the song that's in? I'm curious to know. Anyway, sorry. Okay, so it's not over, Kidney Disease Awareness Month. So now let's go ahead and play my favorite little game, myth versus fact. All right, let's go ahead and put the first myth versus fact statement up. And y'all get ready, med heads. Let me see who's been paying attention around here. Kidney pain versus back pain. What you got?
All right. Statement number 1. If your pain changes when you move, stretch, or lie down, it's more likely muscle pain than kidney pain.
If the pain changes when you move, stretch, or lie down, More likely muscle pain than kidney pain. Put an M1 if that's a myth. Put an F1 if that's a fact. All right. Next statement, please.
Dark brown or cola colored urine combined with back pain can be a sign of a serious kidney condition, not just dehydration.
M2 if that's a myth. F2 if that's a fact. Pencils down. Let's go. Y'all don't need a lot of time. Let's go. Let's go. All right. Any participants in that little quick segment? All right. What you got, Medheads? What you got?
All right. Statement number 1, if your pain changes when you move, stretch, or lie down, it's more likely muscle pain than kidney pain.
What did they say?
We have 13 Joy says F1, says a fact.
A fact, okay.
I remember Miss Sheila. Hello.
Hi, Miss Sheila.
She says it is a myth.
A myth, okay.
Danita says a fact.
Okay, we got a mixed bag here, okay.
Eunice agrees that it is a fact.
All right, Eunice.
Jacqueline says a myth.
All right, Jacqueline.
Miss Aileen says myth as well.
All right, Miss Aileen.
Tisha, hey, we haven't seen Tisha in a while.
Hey, boo.
Tisha says a myth.
Hi, Tisha. Okay.
Member Miss Rosalind says it is a myth as well.
Okay. All right. Let's read the statement again, please, Shador.
If your pain changes when you move, stretch, or lie down, it's more likely muscle pain than kidney pain.
This is actually a fact. It's a fact. And now you see the language. We said more likely. Okay, there are exceptions to every rule. But typically, when you have pain that changes, when you stretch, when it's positional, when you go this way, it gets a little better, go this way, it gets a little worse, more likely than not, that's going to be a musculoskeletal pain, okay? Just more likely than not. For kidney pain, that's the type of pain that once it comes is not typically going to be positional. Case in point, if you have a kidney stone, patients will come in and they'll complain, I'm moving, I'm writhing, I'm twisting, I'm turning, and no matter what position I'm in, the pain just won't get better. Okay, that's going to be one of those classic kidney stone pain. Same thing with pyelonephritis or infection of the kidney. If that kidney is inflamed, then I don't care. You can move up, down, left, right, from A to Z, from Denver to California, IA. It's going to hurt. Okay, so the kidney pain tends to not be positional. Okay, and I'm not saying perhaps you get some type of a little bit of relief, but for the most part, the kidney pain is not going to be positional. You're going to have difficulty getting comfortable no matter how you move, where if it's musculoskeletal, you can pretty much clock it. Okay, when I move this way, it's better as long as I hold this position. Or if I lie down like this and don't move, that's better. But if I go this way, it's worse. Okay, if it's really positional, it's more likely than not musculoskeletal pain, not kidney pain. All right. What else you got? Myth versus fact, statement number 2, please.
Dark brown or colored urine combined with back pain can be a sign of a serious kidney condition, not just dehydration.
Okay.
So with this one, we have Deidre says a fact.
Okay.
Mr. B says a fact.
Mr. B. Okay.
Laura agrees that is a fact.
Hi, Laura.
Dietrich says fact as well.
Dietrich, very busy, very busy. Thank you. Good.
As well as Peace Oasis says it's a fact.
Okay. Did anybody say it's a myth? Hello?
Did anybody say it was a myth, Dr. Frita?
Well, y'all are no fun. Okay, read the statement for me again, please.
Dark brown or colored urine combined with back pain can be a sign of a serious kidney condition, not just dehydration.
That is a fact. Y'all got it right. Everybody come on up to the front. Let me make some room. Come on to the front of the class. Good. That's a fact. Absolutely. Absolutely. So a lot of times, as I'm sure y'all have witnessed with your own selves, if you're running around, you're traveling, you're busy, and you get dehydrated, then yes, that urine will get dark a lot of times. Okay. It'll get a dark kind of a rich amber color. But if we're talking a dark urine that's more like a cola color or even tea, okay, it doesn't have to actually be a red color to be blood, but cola colored urine can be a sign of blood. And if you combine that with back pain, it could be a few things. One, it could be a kidney stone, okay, blood in the urine. 2, it could be pyelonephritis. It could be a kidney infection. And the other thing it could be, if you're having blood in the urine, you could have glomerulonephritis, okay, or a serious inflammation of the kidney cells causing blood in the urine. It could be IgA nephropathy. It could be lupus nephritis. It could be all kinds of things. The point is, please don't ignore it. If you're seeing that back pain combined with blood in the urine, that's something that is serious. And here, let me just give y'all a little taste, because don't worry, I got more information for you. I have a video that after you finish watching this live that you can see where I go into detail about kidney pain versus back pain and when to notify your doctor. Let's play a little clip of this, and then y'all can watch the full video after we finish the live. I'm Dr. Frita, and today we're talking about kidney pain versus back pain. 5 warning signs you should never ignore. I'm a board-certified kidney doctor, and one of the most common reasons that people come to see me in my office is because they have back pain and they want to know if it's their kidneys. They'll wake up and be like, Doc, I woke up this morning with back pain. I don't know if I pulled something, if I slept wrong, or is it my kidneys? And I understand this question, I do, because back pain is actually one of the most common reasons that people over the age of 40 go to the doctor. And of course, your kidneys are located in your lower back. And so I get the confusion, I get the question. But truth of the matter is that most of the time, back pain is not related to kidney pain. All right, y'all. You get some good information. I go through it, I break it down in an evidence-based manner. Kidney pain versus back pain. Check it out after you finish watching this live. Okay, y'all, please go ahead and give me a like, give us a subscribe, give us a follow, all of the things. And if you enjoy having this conversation here, please make sure you join our membership. If you join at the highest tier, again, we have a live Q&A today, right after we finish this live. And then if you actually want to talk to me one-on-one, uno, I do have a telehealth concierge service where I can talk to you from anywhere in the world. And I have been talking to patients from anywhere in the world. I can give you a first opinion, a second opinion. I can talk about, we can review your labs. I can order labs, I can order studies, and I can just really give you an in-depth conversation just based on the qualifications that I have. And I've been having some very, very, very good results, literally from all over the world. I've been able to help people with this concierge service. And so it's been a joy. Click the link in the description, or of course, you can go to my one-stop shop, drfrita.com. All right, Cardi B. All right. Yeah, no, Cardi B stays in the news from her having that trial when the security guard said that Cardi scratched her face and owed her, like $20-something million, to her having her recent baby with who? Stephon Diggs is his name. So, but then they had a big breakup after the Super Bowl, public with her tumultuous relationship with her estranged husband, or perhaps he's her ex-husband at this time. Offset to her battle with Nicki Minaj. Why would anyone battle Cardi B with words? I wouldn't. But with her battle with Nicki Minaj, and they were talking about each other's babies. And now she has a concert, which has been getting just the top reviews. And she's been out there. She's been performing 2 hours straight. And Cardi B says that, well, she's changing her habits and she's really paying attention to what she's putting in her body. And now she's representing a drink that is sweetened with stevia. So let's go ahead and play this clip, and then let's talk about artificial sweeteners. Is she making a good choice?
Get that fake stuff out of here. I told you I'm sorry. I've been working out, but I haven't been working out, but I have been working out on that stage for 2 hours straight. And as y'all know, I only drinking water and Zevia because sometimes I want something sweet, but I need something with 0 fake colors, 0 sugar, 0 everything natural. Get that fake stuff.
Cardi B is a mess. But okay, so she's doing this drink, okay? And we know that all artificial sweeteners are not created equally. Equal, no pun intended. They're not created equally. And so the one that she's using is stevia. So we're going to get back to that one on if that's a good choice. And, there have been different studies that have been done. Do artificial sweeteners cause cancer? I'll tell you what's being said by the National Cancer Institute and the FDA as far as that's concerned. do natural sweeteners actually cause you to have an increase in blood sugar? I'll talk to you about some studies, some mouse studies, okay, and some human studies. And then I'll talk to you specifically about her choice with the one that has stevia, and if all things considered, if that's a relatively good choice. But I do want to ask you this, and give me a soda can. Is there a soda can emoji? Give me a soda emoji and answer this question for me, please, med heads. When it comes to choosing your beverage, what's most important to you? Calories, taste, caffeine, ingredients? Like when you're really choosing a drink that you're going to have a beverage, what's most important to you? So tell me that, and then I'll tell you a little bit more about these sweeteners. So artificial sweeteners. When we first started hearing about artificial sweeteners, or when they, were first kind of got FDA approved, the whole point was to try to avoid table sugar, right? Because we know that with high amounts of table sugar, well, one, that's high calories, and then that can lead to a person living with obesity, then putting you at risk for diabetes, high blood pressure, high cholesterol, early cardiac death, all of those things. And also maintaining, healthy weight in general. The thought was with artificial sugars and them having low calories, some do, some don't. We'll talk about it. Having the lower calories and still getting the sweet taste. That was another thing that made artificial sweeteners very attractive. And so a lot of diabetics have been drinking Diet Coke for years and years and years and years and years, right? Or just using these artificial sweeteners instead of traditional table sugar. But again, all artificial sweeteners are not equal. So let's just break down some of them. So stevia is the one that Cardi B's drink has. And so we'll talk about that one last. But aspartame is one of them. And you're familiar with aspartame because that's what's used in Equal, okay, and in NutraSweet, okay? So interestingly, as far as calories are concerned, aspartame actually does have calories, okay? It has like 4 calories per gram, which is actually similar to the amount of calories in table sugar. So what's the point? The point is that it's much, much sweeter. Aspartame is 200 times sweeter than table sugar. So even though pound for pound, they might have similar calories, you're going to ideally use much, 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 much less aspartame, right? Which then could give you a calorie reduction with the same sweet taste. So that's the thing with aspartame. And there have been some different studies. I will say that according to the National Cancer Institute, there has been no data proving a causal cause and effect between the aspartame and cancer. Okay. And so that's why you see the Equal, the NutraSweet, they're still FDA approved. And there have been different mice studies and some different whisperings about, but according to the National Cancer Institute, there's no proving causation of aspartame in cancer. Now, we'll say as far as using the aspartame, if you're going to cook with it, don't. Okay. Don't cook with it. Don't bake with it because it's not stable in heat. So please don't do that. So that's the aspartame, the Equal, okay, the NutraSweet. And then there is saccharin, okay? Saccharin is going to be your sweet and low, those pink packets, and it can be up to 500 times sweeter than table sugar. So again, same concept. You're using much, 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 much less to get the same sweetness. I do believe that it is more stable than heat than is aspartame. I personally wouldn't cook with it still. I'm sorry, but it just kind of is one of those things that theoretically, okay, it's, going to be low calories for you. You still get a sweetness. There you have it. But can these things actually increase your blood sugar? Ooh, I can't wait to tell you the data. And then you have sucralose, okay, or the Splenda, right? And the sucralose actually has 0 calories, okay, and it's up to like 600 times sweeter than sugar. The thing is, sucralose is oftentimes mixed with some other artificial sweeteners or even some sugar alcohols. And Splenda, okay, is where you're going to get the sucralose with the mix of some other things as well. But yeah, it's going to be 600 times sweeter. And again, in the sweeteners that I'm mentioning, even though there have been different mice studies and different implications, according to the FDA, these are still approved with no proven cause of cancer. Okay. So just making sure, in the United States, that's how we're rolling with it. And then there's the stevia, which is what Cardi B is representing as far as that drink that has the no calories. Okay. Stevia. So I mentioned, like I start off with aspartame. What I didn't tell you is that there's nothing natural about aspartame. Okay, that has it's made with 2 different amino acids, and it's something that is constructed. The stevia, though, that Cardi B has in her drink actually is plant-based. It actually is natural. Okay, and so that's going to give it a pro, something that's plant-based. The other thing is it also actually has 0 calories. Okay, that's going to give it another pro. But then, is it actually healthy? I don't know. Is it coming from the stevia leaf? So here's the thing. Does stevia increase your blood sugar? So, and talking about some of the other things that we talked about, the aspartame, where, that's like the equal in the NutraSweet, and the saccharin, there have been some studies, listen to me, that show that even though these are very low calorie or 0 calorie or using small amounts, there have been studies showing that some people in mice who have used those artificial sweeteners, I'm not talking about stevia right now, that there's been an increase in blood sugar. What sense does that make? Well, I'll tell you. Specifically in the mouse studies, they found that the mice who were using those artificial sweeteners like the aspartame compared to the mice that had just regular table sugar, the mice who were using the aspartame in some studies actually had higher blood sugars, and they found that it was because it changed their gut biome. Okay, your gut, like the flora in your gut. And in changing the gut biome, that increased their body's blood sugars. Okay, so it changed the flora of their gut. Imagine that. And in those studies, they even did, okay, this gets graphic. This is science though, y'all. Give me a like, y'all. This is some science I'm talking about. And give me a like before I tell you this, because it's about to get a little bit gross. They transferred the gut contents, what's in your intestines. They transferred that from the mice who were doing the artificial sweeteners and had high blood sugar. They transferred the contents of their intestines to the mice who were eating the table sugar and actually had better fasting blood sugars than the ones who were doing artificial sweeteners. And then once they transformed that gut, the feces, to those mice, they also developed high blood sugar. And so then that was consistent with saying that even though the artificial sweeteners like the aspartame, even though they had, low calories, as far as the amount that they were using, they ended up changing the gut flora, and it was the gut flora that caused the high blood sugar. Okay, that's mice. Take it to humans. There was a study, we don't have huge studies as of yet, to my knowledge, but there was a study that had at least 400 people, and they found in some patients, not all, in some patients, similar results. Patients using like the aspartame as opposed to using table sugar, some of them did end up developing higher blood sugars, higher fasting blood sugars, and they tested their guts, and similar scenario, their gut biome, the gut flora changed. And for them, when they transferred their gut flora, they didn't transfer theirs to other humans. They transferred theirs to mice that had normal blood sugars before. And again, with the people using the artificial sweeteners like the aspartame, they transferred them, their feces to mice, then the blood sugars went up. Okay, so that's not a huge study, but the mice one that was, of course, they're mice, we're humans, but it just lets you know that the science is out there. So now let's go to what Cardi B is talking about, the stevia. Studies have shown that the stevia is not causing an increase in blood sugar. So the stevia is plant-based. The stevia has 0 calories. The stevia is not causing an increase in blood sugar. And so nothing is going to be perfect as far as sweeteners that you're using, but when you're weighing the science, it does look like of the artificial sweeteners, the stevia is going to have the least amount of side effects and more benefits, as in low calorie, low blood sugar. And even some studies are suggesting that the stevia can be associated with better blood pressure. And so I checked it out, Cardi B. I checked it out. Now, I don't look at her like my health influencer, but I have to say she must have done her research, and her team must have done her research, because of all the artificial sweeteners, it sounds like she picked the one that has the least consequences. So just make sure you always consult with your doctor and your dietitian before you make changes. But I thought it would be kind of neat to run through, because all Diet Cokes, especially if they're having some of the aspartame, might not be the healthiest choice for you and might not be healthy for your blood sugar. Talk to your doctor about it. Did anyone answer what they think is most important when they pick their drinks?
Yes, of course, Dr. Frita.
Yay. And y'all give us a like, please. And thank you.
Peace.
Wait about this.
Peace Oasis says, I like things to be, I don't like things to be too sweet. So for the rare times I drink anything other than water, I need it to taste good.
Okay. So you don't like things that are too sweet. Because some people love them a good sweet red drink, blue drink, and that's how you know it's gonna be sweet when it doesn't have a flavor to it. But you don't like your stuff too sweet. Okay.
Deidre says ingredients and taste. It's
Ingredients and taste. Okay.
Miss Rosalind says taste, ingredients, and most important, the sodium or sugar. So yeah, her go-to drink would want it.
That's good. And especially because like when we're dealing with table sugar and sodas, and just one soda, it will oftentimes have like more grams of sugar than's even recommended in 24 hours. Depending on the size of the soda. And so, yeah, looking at the sugar content is very important. But now, based on what I just shared, depending on the type of artificial sweetener, that could have long-term high blood sugar. So just something to watch. And we'll talk more about it.
Mm-hmm. Marina. Hey, Marina.
Hi, Marina.
Marina says, what's your thought on agave as a sweetener?
Well, that's something. So again, you're not going to have anything that's perfect. I will say, as far as my top ones, it's going to be stevia and the erythritol as well. That's one of the sugar alcohols. And those are going to be my top two, plain and simple. As far as the other sugars, be it agave, be it honey, you're still going to need to do it in moderation, okay? Because it's still going to have some of the consequences as far as potentially leading to high blood sugar. Agave versus straight table sugar, I'll choose agave, okay? But agave versus stevia, I'll choose stevia. So it's going to be just different levels to it. Everything's going to have to be in moderation, and water and no sugar is just really long-term going to be the best. Yeah.
All right. And then Tisha says artificial sweeteners kidney friendly.
Oh, yes, they are. Specifically, the stevia these are kidney friendly. There's no kind of a reduction or a decreased amount that you need because your kidneys aren't going to filter them. So yeah, that's okay. Yeah, but you can have all the stevia. You can sweeten your drinks with stevia and be fine for sure.
All right. And Janice said her go-to would be the sparkling ice water.
Oh, that's good. Okay, so like if you have a little taste, you want a little soda taste, then getting some sparkling ice water. And I know I even like to put some lemon and lime in some of my sparkling water if I have that little soda taste, but if I'm trying not to have too many calories or artificial colors or all of those things. That's good. Okay. Good. All right. Allergy season. Anyone having any allergy symptoms? Oh, shoot, Shador. I forgot about shoot. Yes, allergy season came early. Oh, my goodness. Listen, I want y'all to put in the chat and give me, is there a nose emoji? Give me a nose emoji. And if there's not a nose emoji, there's a Pinocchio emoji that has a long nose for nasal snuffles. Look, now I'm pinching my nose. So y'all, allergy season came earlier this year. Put a nose emoji in and tell me what, if you experience seasonal allergies or allergic rhinitis symptoms, what are your most worrisome ones? Oh my goodness. Put that in the chat and let's play this clip, and then I'll run through number one, why allergy season came early and tips on reducing your allergy symptoms.
Thank you. If you feel like you've been sneezing more this allergy season, you're not alone.
Yeah, Georgia Peck spoke with local doctors who say there's a reason for your worsening allergies.
Take a look at any car in any parking lot right now, and it's hard to miss. That yellow dust coating everything is pollen. And this year, doctors say it's worse than usual.
In this time of the year, pollen's really coming from trees. And when they start, that part of their reproductive cycle is really based on temperature conditions.
Dr. Charles Sasser says the warmer weather means more pollen. And it's not just making you sneeze. High pollen counts can also make you sicker by opening the door to infections.
When we're having a reaction, then, our nasal passages are going to become more inflamed. So that's going to, cause you to be symptomatic. But additionally, that's also a really nice nidus or site for infection to set.
That's good.
Make you more susceptible.
Yeah. So definitely allergy season is coming earlier. And according to the American College of Allergy, Asthma, and Immunology, would you believe part of the reason, climate change. Okay. We're getting some milder winters. We're getting summers that are coming a little earlier, springs that are coming earlier. We're getting increased carbon dioxide, and we're getting these hot, humid conditions earlier than normal. And that's leading to an acceleration of plant reproduction, which leads to tree pollen being in the house earlier, because that's kind of the first thing that comes about, the tree pollen. And so if you're someone who's allergic to tree pollen, then you might be noticing that you're starting to get symptoms earlier and earlier. Let me see if medheads, tell me what you think some of the symptoms are, what you know they are, what some of your symptoms are, and then I'm going to run through some tips on how to reduce your symptoms.
All right. TS says asthma gets worse.
Okay.
So use a rescue inhaler and nebulizer. Eyes water, nose run more.
Okay, so your immune system acts up. So not only for the facial, eyes, nose, but it takes it all the way down and triggers you to get asthma symptoms or tight breathing tubes, tight bronchioles. Okay.
Peace Oasis says sneezing and watery eyes.
Sneezing and watery eyes. That's a very common one. Yeah.
Let's see for there right now. I know for me personally, headaches, congestion.
The congestion. That's a tough one. Okay.
13 Joy says scratchy throat, stuffy nose, itchy eyes.
All the symptoms. Very good. Yeah. Very bad, but very good. These are symptoms. We'll talk about some ways to reduce it.
Anita says tearing eyes, runny nose, and sneezing.
That's it. Yep. And I'm already seeing them because, when I was just with the family this past weekend, one of my little cousins, hey, Joshua, and another one of my young cousins, hey, Corey, with just noses, just sneezing, all this kind of stuff. And my sister, Miss Jetty, why she had it on deck, I don't know. But she happened to have Zyrtec just on the string. And she was handing out Zyrtec. I said, oh my gosh, we got a whole allergy pharmacy right here down to the family gathering. Okay. All right. Anyone else? Now I'll give y'all some tips on how to reduce your symptoms.
Oh no, I think those are the ones that you touched. Okay,
good. And y'all hit on them. So yeah, you can get itching eyes, red eyes, runny eyes, nasal congestion, itchy throat, sneezing, and when it spreads, if you have asthma, then that immune system can trigger you to have tightening of your bronchioles, asthma attack. So these are some of the common symptoms of allergic rhinitis. And we know that allergic rhinitis occurs when an allergen, a particle, something like pollen or mold or pet dander, when the allergen or particle triggers your immune system to have a certain reaction. And so if you have allergic rhinitis, also called seasonal allergies, hay fever, then something like pollen, for example, would trigger you to have all the symptoms that we just discussed. And it can really just lead to kind of a poor quality of life. Like nobody wants to deal with that. It's not fun. So let's talk about ways to reduce your allergy symptoms. And remember, what I give you here is informational. You always want to consult with your doctor. So the number one tip is try to keep pollen out your face. Okay. Try to avoid the pollen. So you go outside, wear glasses, wear a hat with a brim, try to minimize the contact of pollen with you. And when you go back inside, don't crack the windows for fresh air. Close the windows because you want to keep the pollen from being in your house. Don't roll down with your top down in your car, trying to, stunt up and down Peachtree Street. Roll those windows up. Okay. Close that sunroof. Keep the pollen out of your face. That's going to be the number one, avoiding pollen. Also, when you come back inside of the house, change your clothes. Okay. Oh, I'm changing mine right here. Sorry. Change your clothes. Okay. You don't want to be in the house still breathing in the pollen from outside. And when you go to bed, don't get in the bed without taking a shower or a bath. Get that pollen off your body. If it's gotten in your hair, wash your hair, wash your face, wash your body, have fresh clothes. Don't have pollen in your sheets. Another thing that's important that people sometimes forget, if you have pets like Shadow and Nico, when your pets go outside, they get pollen on them also. Okay. So there's no real point in you getting pollen off of yourself, but then you sit up there hugging and booed up with your little, Portuguese water dog. Wipe your pets off. Make sure that they have the pollen off of their bodies, or else you're going to be triggered by your pets. Okay. So staying away from the pollen. Here's another very important thing, and this is a non-medicine way. Rinse your nose. Use nasal saline. Okay. And you can get it over the counter. Literally, it's salt water that you put up your nose. And so if you get it over the counter, it'll come in a container and have a little nozzle. Okay. And you put it up your nose and you aim it toward the outside corner of the same eye. So first thing you do is you put your nose down. Okay. Put the nostril up your nose, aim it toward the outside corner of your eye, and you just really flush. Don't aim it straight back because then you're going to gag on the normal saline. No. Aim it toward the outside corner of your eye and just really flush out. What that's going to do is it's going to flush out these allergens, okay? It's going to flush out the pollen. It's going to flush out pet dander. It's going to flush out dust. It's going to get rid of excess mucus. And so you can do that several times a day, okay? Or several times a week, whatever you need. And that's going to help to keep you from having the reaction to the pollen. Now, if you still have symptoms, then you can consider an over-the-counter medication. Again, consult with your doctor, something like a nasal steroid, like a Flonase, okay? Or a Nasacort, because first, clear out your nostrils with a nasal saline, and then same thing, put your nose down and then aim that nasal steroid toward the outside corner of your eye. Read the instructions, consult with your doctor. If it's Flonase and you're an adult, it might be 2 sprays to each nostril once a day, and you might end up decreasing the frequency. Again, consult with your doctor, but that's one way to do it. There's different types of nasal sprays. I won't get into everything, but when you're dealing with decongestants like Afrin, you don't want to do that a lot, okay? No more than 3 days in a row. Consult your doctor, because then you can get some problems with the decongestion. But with something like a nasal steroid like Flonase, that's something that can be used every day. You might still get some side effects like a dry nose. But bottom line, consult with your doctor, because if doing all these things still don't help, you might need to see an allergy specialist, and they might recommend some immunotherapy like allergy injections, allergy shots, or some other immunotherapy pills. But bottom line, it's not in your mind. Allergy season is here. Get used to it, but protect yourself. All right. What we got? We're going to head on out the door. Do we have any questions or any member comments on the way out? Because we're about to head to the members live Q&A.
Yeah, real quick, Dr. Frita. There's a popular brand, I'm not going to name it, who has an allergen neutralizing spray for in the home when those pollens and everything comes inside the house.
Okay. I still say consult with your doctors before you're doing anything. Yeah, I probably should stop saying name brands, but I'm just telling you the ones that I recommend. And also I'm telling you what my kids' allergy specialists recommend for them as well. And once we finish with this, y'all check out, I do have a short form content. I'll make sure I have it. Just follow me on all social media platforms, because I have different things on different platforms. And on at least a couple of my platforms, I put some of these tips on how to reduce allergy symptoms. It's a nice short form content, something that's easy to share or easy to listen to really quickly, without listening to a whole hour. So check out that after we finish this live.
All right. Shout out new member, Miss Janice. Hope you're going to join our Chief Med Heads here shortly.
Thank you for joining. Thank you to my members. Thank you to everyone is here. Thank you for those of you who subscribe. That's a free way to support the channel. Thank you to my replay crew. Y'all know I see you. Thank you for commenting. Thank you for being active in the chat. Thank you for sharing. Thank you for participating in our different games to really try to make learning fun. Because of course, this is our live stream, Dr. Frita Live, where we do talk about the latest trending medical headlines and celebrity health news. And most importantly, we take all this information and what's all going on so that we can learn and so we can live our healthiest, happiest lives. So again, I appreciate you. Please make sure you give us a like before you head out of the door. And for my members of the chief resident level, I'm about to see you right now at the live Q&A. And for all of my members, stay tuned. I am posting another members only video for you this afternoon. For my residents and chiefs, I posted one this morning on the members only. Y'all, we have all kinds of fun. I appreciate y'all for joining us here on Dr. Frita Live. I'll see you next Monday, same time, same place. And I want to thank you for making Monday your healthiest day of the week.